The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation, headquartered in Newport News, Virginia, and the National Patient Advocate Foundation in Washington, D.C. Today, the foundation has 7 offices across the country, with over 100 employees and over 160 volunteer attorneys. Last year alone, the foundation solved issues for 44,580 patients across the United States and received 6.8 million requests for help and information. 4% involved children under the age of 18. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained. They have diverse backgrounds. We have nurse case managers, RNs, LPNs, OCNs, licensed clinical social workers, coding and billing experts, Social Security disability determination experts. And when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case. And then that person, that case, is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
The Copay Relief Program is a wonderful help with the cost of breast cancer care medications being so high. I appreciate the assistance. PAF helped me understand the situation with my insurance. They've proved to be a very nice support system in overcoming the feeling of being so alone during my diagnosis. The Copay Relief team listened to us. They were very understanding. They helped us at a time when we didn't see where help would come from. Thank you.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And I remember the days that we were doing the same thing with Cheryl. And the fact that my husband was diagnosed with stage 4 cancer just 2 years ago was an immediate reminder as we moved our lives to Durham for 2 months that there but for the grace of God go any of us. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's really a shame that we're needed, actually, but there's no other organization out here doing this, and we feel called to do it, and it's just so necessary.
Mary Schwartz was a single mother of a 12-year-old boy when she was diagnosed with a rare form of thyroid cancer. Her local oncologist sent her to the University of Virginia Medical Center, where she was told there were no treatment options available, and she had 6 months to live. To make matters worse, her insurance company refused to pay for the tests performed at UVA.
You know, you work, you pay for this insurance, and then when you need it most, it's not there for you.
A coworker referred Mary to the Patient Advocate Foundation, where she was put in touch with Shauna Hatfield, a senior case manager.
Well, they're distraught, and it's almost like they're in a sense of, I don't know what to do. I know I have this diagnosis, but I have no clue on what to do next. They have no guidance. It's almost like they're numb.
It was a relief, a real relief, because I was talking to somebody who knew exactly what I was going through, had been through this before with other people, and within 10 minutes had made a very positive step in helping me.
Shauna was able to get Mary into a clinical trial at the National Institutes of Health. The result? Mary has been cancer-free for over 3 years, and she credits the Patient Advocate Foundation with saving her life. Trevor Woods was in her 20s when she was diagnosed with stage 4 breast cancer. She had health insurance through her employer, but when Trevor was forced to leave her job due to her deteriorating health, she found the COBRA payments too high, and she lost her insurance.
The bills were coming in, oh my God, by that time, because she had stopped work around March of 2005, and the bills, I mean, they were worrying her probably more than the cancer was.
Even though Trevor received Medicaid, the spend-down amounts, like a deductible for Medicaid, were unaffordable for Trevor. Fortunately, the Patient Advocate Foundation was able to get financial relief for these bills through charitable resources.
You can imagine just 11 and a half short years ago, we're in a 10-foot by 10-foot office here in the park in Newport News, and we had 157 people find their way to our little phone. And in 2007, we had 6.8 million people reach out to this organization for some form of help or information, and over 44,000 that became cases. It's a tragic statement about the fractured healthcare delivery system that we have and the growing uninsured population.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
To make a donation or for more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274. The Patient Advocate Foundation has touched over 20 million people. With your support, they can continue to make a difference in the lives of millions more.
Hi, I'm Troy Gentry, Montgomery Gentry. From my mom's long struggle with cancer, I know the impact a life-threatening disease can have on a family as well as the expense it brings. In today's world, having health insurance doesn't always guarantee you access to the care you need. For those without insurance, it can nearly be impossible to get needed care. Whatever the reason, whether you have no insurance or you're facing insurance denials for medication and procedures, the nonprofit Patient Advocate Foundation can help you at no charge to you. Their experienced case managers have a history of positive results. They want to help you as your partner. Patient Advocate Foundation has touched the lives of over 21 million people solving healthcare problems since 1996. If you can't access healthcare, time and delay can mean the difference between life and death. Disease doesn't wait. Call to request your PAF partner today at 1-800-532-5274 or go online to patientadvocate.org. Every patient deserves a partner. From the words from our hit song, Something to Be Proud Of, I'm proud to support the great work of the Patient Advocate Foundation. I'm Troy Gentry, and I support the PAF as their partner.